Indian healthcare infrastructure is designed to support the acute diseases more than the chronic ones. Chronic diseases require personalized and also long term monitoring to effectively lower the associated risks. For instance, in case of chronic diseases like diabetes, like India is the diabetes capital of the world, unfortunately, 80% of the patients can face an untimely death if proper monitoring is not provided. So here we are with our healthcare startup series. Hi, this is Smita, and you're watching Medicircle. So today we are having a healthcare startup with us, and we are trying to find out how they are helping patients, especially with chronic diseases, and their monitoring, which is very, very important, so that they don't lose their lives, and something is there to protect them, and that is also affordable. Also, that's the prime goal of such startups. So today we have Subhashish Sircar with us. Dr. Subhashish is an engineer who has worked with over 2 decades with organizations like Lockheed, NASA, and many others. He holds over 20 international patents in different sectors. He has completed his PhD from Michigan State University and later did his MBA from Wharton School. So hi Subhashish, welcome to Medicircle.
Thank you, Smita. Thanks for taking the time to talk to me.
I mean, it's our pleasure because we at Medicircle always try to inspire other entrepreneurs and especially the younger generations of India to explore them, know them more about, read them more about how the startup ecosystem, especially the healthcare startup ecosystem, is taking its shape in India, and how different ventures are offering such innovative solutions which are just not technologically sound but also cost effective, that's made more affordable, remotest of ends of India. So to begin with, Subhashish, as you're the founder of Health Vectors, tell us more about your venture and its offerings.
Yeah, so, Smita, I was listening to you and I had some, feelings that I will tell you right off the bat. I had a personal tragedy, which was when I lost a friend of mine. His name is Shoktik. He was just 32 years old and he died due to cardiovascular complications. Okay. He was just 32, as I was saying. I quit my 30 years life in the US, and my life focus became, how do we prevent this? Now, the word prevent has different meanings to different people. To me, it means that, how can I prevent a person from becoming diabetic in the first place? When you're diabetic, to prevent it from going into complications, there are many organizations that do that. And I mean, it's basically about monitoring, as you said, and basically about looking at what can be done to prevent it. But as far as Health Vectors is concerned, of the many things that we do, one of the things that is extremely important is monitoring a person before the person becomes diabetic. In the sense, can I actually calculate the risk that this person has of becoming a diabetic? And then from there, can I actually lower the risk so that the person never actually becomes a diabetic? Forget about the complications from diabetes. So prevention has different meaning to different people. We are all about predicting and preventing. That's one of the I would say focus points for Health Vectors without any question. So I started this journey with a van and a medical. I came to India because Shoktik was lost in India. And I got some money from a friend, angel investor who put some money into this. And I went from corporate locations to corporate locations because those are where the younger generation people are in their 30s, in their 40s. And I would go and, not only measure their health parameters and do the analysis and all that, but provide them with smart health insights and show them how they can reduce the risk of becoming any of those: diabetes, hypertension, cardiovascular disease, heart attack, stroke, all of those. Okay. We, started in India, and now our presence are in various markets abroad. Okay. So you can term Health Vectors as a personal health analytics company that is headquartered in Bangalore, India. We are a team of about 13 people, 13, and we are focused in the personal wellness space. Remember, illness is something that we are trying to avoid. Okay. And so that's, but we do cross over into the illness space. So a person who is diabetic is not off our list. A person is diabetic, we certainly will help them. But we also try to see if we can show them a way before they even become diabetic. Just an example. We are focused very much on a holistic health. When I say holistic, taking everything together and not treating one or two parameters or one or two problems. Okay, we're all about preventive, like I told you, and all about predictive health. Okay, so we've built a very sophisticated analytics engine that took us a long time to build, but this analytics engine that I'm talking about creates as an output smart reports, for example, health insights for the individual as well as for organizations, health Sybil for insurance companies, where we are able to actually tell the individual as well as the insurance company what is the probability of claims that this person has from the insurance company. So the claims exposure to the insurance company from this individual. So now I'll tell you something that may probably not be very well known. We are the pioneers of people who built smart reports. So there was nobody out there building smart reports before we started, and we coined them as smart reports because they were really smart. They can actually look at you, the bunch of parameters together and tell you what you need to do without having you to deal with all that together. Okay. And then the health Sybil was also coined by us. So those are the two things I wanted to make sure that was documented as health vectors. And then today, I would say we are up till now, we have raised about 1.6 million. And we are a cash positive company. And we have bagged marquee clients in India and abroad. So that's in a nutshell what we do. I mean, basically, if you really look at health vectors is saying that, health data in itself is very complex. So people find it hard to understand and take charge of their health. So can we actually do something to help that individual understand their health better with the use of smart reports and smart and easy reports? And then the next thing is organizations like insurance companies, like diagnostic labs, hospitals, they have a lot of data, personal health data, but they do not derive business value from that health insights available in that personal health data. So if you look at our analytics engine today, it is capable, it's got some 250,000 rules that are built into that analytics engine. Okay, it is capable of looking at 300 plus parameters simultaneously, and it performs 70,000 calculations, and almost 10,000 decisions are made by this engine before rendering a solution in a matter of seconds.
That's great. So that would be definitely one of your prime USPs, because there are other preventative healthcare ventures also, like Healthy and Xyla Health. So apart from, like as you said, that smart report was something that you started building in, but no other such company was doing that, because definitely a lot of people, especially when I came to know about health vectors, every time we get our diagnostic reports, it's very difficult to interpret it. And I think that's one very important problem that you are solving. So apart from that, any other USPs of health vectors which you would like to share with us?
Yeah, sure. So if you really look at health vectors, this is an engine that we have been building this over the last 8 years plus, and as such, the engine is extremely detailed, very holistic in its domain knowledge, if you look at it. And then now it is something that is used by several top labs in India and abroad. You can name top labs in the country, and you will see that health vectors is the sole provider of solutions to those labs and through them to the individuals. We have actually worked through the entire acceptance of this analytics engine. It is scrutinized and finally validated by 100 plus doctors from top institutions in India and abroad. So that is one of the biggest things about us. We are focused on preventive and holistic health, not a single parameter. So if you have diabetes, and let's say you, along with that, you have hypertension and you have a thyroid problem, and God forbid you have uric acid problem also. Now, how do you take all of this, and instead of getting confused, what are the simple things that you can do, in terms of what you eat, what you avoid, which doctor you need to go see, how should you be following up your test results? All of these things are something that we are able to do. So the engine, if you really look at it, it is created in a way that it thinks like a doctor, okay, with a varying set of health parameters, all the different ones, and guides you to the next steps. to avoid future complications. So we are more so in the preventive space. Like I said, the health vectors analytics engine analyzes a lot of parameters together, and it's passed the test of time. If you look at Xyla or Healthy, and you'll see they're more of an aggregator. They solve the last mile problem with individual patients, more of reactive medicine, I would say, well, with specialists, endocrinologists, cardiologists, and maybe other health workers like, for example, nutritionists, physiotherapists, and all that. And their AI engine, if you really look at it, is more about answering patient queries. But the way we do it, we are focused, as I said, on predictive and preventive health. But as I will again repeat, our engine was created by a set of doctors, and the solutions are generated in a matter of seconds. It's with zero human touch. So if you look at it from the perspective of scaling up, it is so easy for our solutions to be scaled up. We can do thousands and thousands of reports in a matter of seconds. That's the kind of scalability that we have with the accuracy. So one thing that is extremely important about our analytics engine and our solutions is that we have all the references that has been used to create the solutions is always available to the end user, so that they never doubt about the content or the efficacy of the solutions that we provide.
Yeah, that's one very important thing to build up, I think, customer satisfaction.
Yeah, and very honestly, I will tell you, if you look at Healthy or even look at Xyla Health, we really don't look at them as our competitors. We think they are in the same space as us. They are serving a certain need. We are serving another need, and there are ample ways in which we could be partnering. For example, for their last mile solutions or components, when we go D2C, we have aspirations to go direct to consumers. So that would be an ideal time for us to do that. And they can always use our analytics engine to be able to give much more precise solutions back to their end users.
That's a very, humble thing, because a lot of entrepreneurs have this thing that they should always be competing. But if it is the matter of health, definitely, if any such other player in the same market can help you with this thing, it would be really, really great, especially benefiting lots and lots of patients. So Subhashish, as you mentioned that you have raised some funds, and so tell us how much funds you have raised and how have the funds been utilized so far?
So when I first started the company, somewhere closer to 2012, so I got that $500,000 from friends and family, yeah, and then in 2018, we raised about another 1.1 million. So in total, I've raised about 1.6 million. And the funds, we have pivoted quite a bit. So we didn't succeed as soon as we started. So it took us some time. So thank God we had some money to fall back on. But we were always generating revenue, some revenue or the other we would generate. But once we received that extra 1.1 million in 2018, I'll tell you, we used the funds mostly to develop the analytics engine. It became much more versatile. It can take so many different parameters now. Customers have made it even more capable right now. And then we use that money to sharpen our tech stack and absolutely hone in on the product market fit. So today, I feel happy to say that without any sales team, any marketing efforts, we have been able to do very nice business because we have hit that product market fit. So that's how we have used the funds.
So tell us, Subhashish, how many lives Health Vectors is touching now, and how many you plan to touch next year?
Yeah, so, if you look at it from the time that we started to now, we have touched about 700,000 lives. Okay. But now, if I look at my March numbers and I do an annual run rate, that number goes to, again, another 700,000 for this, for the next 12 months, if I can go that way. And so I'll tell you, by next year, because of the contracts that we're getting ready to sign, we expect to be somewhere about 3.6 million lives touched in the next year. just the next year. It does not include the 1.4 and 1.4 that would have already touched by then. So that would mean about 5 million lives we would have touched by then.
That's great. And what goals do health vectors want to achieve in this year 2022? Because as we are post-pandemic and now we are returning back to normalcy, and so, but again, health consciousness is been there in a lot of people, and people are seeing like a paradigm shift from sickness to wellness. India is, I mean, awakening up to this fact that people don't want to fall sick further, and they want to take all sorts of measures so that they are not falling sick. And that's one preventative thing which is happening. And I think this is the right time for especially ventures like yours, vectors, where they're actually helping people to find out that, yes, how healthy they are. So do comment on that.
Yeah, so basically, we are a cash intense marketing and sales initially with people all over. And this is all going towards that bigger goal to enable the world to live healthy with certainty, one individual at a time. And in fact, what we are doing is I am so proud of my team. I keep saying that we are going to add to this world-class team that we have and solve some amazing problems and create some more and more IPs in this space, and as add to the sales team for international expansion, like I was mentioning. And finally, we are poised to actually go for a direct-to-consumer app. That is, sometimes this year, we will keep pushing to see how quickly we can get there. We are in the process of building that app also. So those kinds of things are what we would like to get to.
So that's great to know. Once again, we thank you, Subhashish, for joining us today at our Healthcare Startup Series. It's always a pleasure to know how startups like Health Vectors are actually helping patients' lives, especially in such a case when people are opening up to facts like they want to be healthy, and they also want to interpret their diagnostic reports, which is really a challenge with so many patients. And even here, that when you're talking to the doctor is not able to act, because as there is such a poor ratio of doctor in patients here in India, the doctor is not able to, devote that much time. So in such a case, we definitely need to depend on engines and artificial AIs, where they are interpreting your report and letting you know, so that you are able to make informed decisions about your health. So
absolutely,
with the health.
Yeah, thanks. Our goal is to make sure they remain subjects and not patients.
Yes, definitely.
Thank you.
Once again, Subhashish, for joining. It was a pleasure having you with us.
Thanks for having me. Bye-bye.